Hi, this is Mary Colbert. Welcome to our Divine Health podcast. And my husband,
Hey, this is Dr. Colbert. And Mary, I'm excited because
I know you are.
I've been working
You're always
hard.
excited,
I know,
Don.
but I'm really excited about some of this new information because I've been working on a new book that'll be out next year called The Brain Zone. And in researching this book, I came across one of the main causes of dementia, which was really shocking. And then I drilled down on this, and it came up with a lot of good information that's going to help people.
It's really amazing. There's so many scriptural things that come to my mind about this podcast before we get started. But from the title of the podcast, you already know what we're going to be talking about. So I want to set some groundwork for those that are listening so that you are of the same mind. You know, the scripture says that my people are destroyed for lack of knowledge. And what Don is trying to do, and he goes to these conferences all over the world, and he is researching continually, trying to find the most current, accurate information to bring to you, the listener, on this podcast. And it's his desire, and it's his heart's desire, is to bring to you the most current and accurate information. Because let me just tell you something. You know, science and knowledge is changing. It's changing at such a huge rate that something we may have said 3 years ago may be updated and not completely the same thing. So that's why Don stays on top of it, changing the new information for what they can see right now. So the one thing we do not want to do, and I hope you hear me on this, is we do not want to perpetuate a spirit of fear in you. It's our desire. You know, the Word of God says, I have not given you a spirit of fear, but of love, power, and a sound mind. So that is our desire, to impart to you knowledge, that you become empowered with what you can do, but not to go into fear and think, oh, my Lord, you know, this is me and this is what's going on with me, in order to put you in some sort of chaotic fear. So having laid that foundation, Don, this past weekend, went to a conference. It's all fresh with him right now. And he saw and heard some of the most amazing studies and research on this topic of mold and what's going on with people. And so, Don, I didn't hear everything. I wasn't in the...
Mary, you were in and out for 5 or 10 minutes.
So I
each
can't
time.
wait to hear also this podcast of what you're going to be saying. So I may interject a question here or there if the listener. So,
but we're titling this talk just Strange Symptoms and Diseases Due to Water Damaged Buildings. And what happened is, as I was writing my book on the brain zone, I'm writing a chapter on dementogens, which are substances that can lead to dementia, like a carcinogen is a chemical that can lead to cancer. Well, a dementogen is a substance that can lead to dementia. And one that I found was water-damaged buildings. And I said, water-damaged buildings, what's that? Well, there are these mycotoxins or mold toxins that are in water-damaged buildings. It could be your house. It could be your office building. It could even be your car. And these buildings literally can make you sick, and they can cause all kinds of weird symptoms. And these symptoms can be, there's like 37 key symptoms with 13 different symptom clusters. But the diseases that walk in the office that commonly have these are diseases like fibromyalgia, chronic fatigue, brain fog, multiple chemical sensitivity, irritable bowel syndrome with diarrhea, chronic sinus infections, dementia. There's a toxic dementia due to mold toxins, and unexplained weight loss, severe food sensitivity, severe headaches, and migraines. But these migraines are different. It feels like someone is stabbing you with an ice pick in your brain. Also, strange neurological symptoms like pseudo-seizures or tingling or tremors or numbness or even some MS-type symptoms, strange neurological things.
now before we go forward, let's give some symptoms, Don, to the listener so that they can listen and say, wow, okay, that they may want to investigate a little further, that they may not have this gene to detox mold, and they've got these symptoms. There's some
Okay.
things. So
Well,
let's talk about
yeah, let's talk
symptoms.
about symptoms. First of
Yeah,
all, if you go in a house or a moldy environment
our workplace.
or workplace and all of a sudden you feel severe brain fog, you get severely congested in the nose,
You're
and
sneezing.
sneezing, but severe nasal congestion,
Okay.
severe brain fog, severe fatigue where you can't even think, get out. You have 5 or 10 minutes to get out of that environment, or else it's going to literally increase inflammation in your body. But there's 37 key symptoms. So let's go over these, and let's just kind of, now again, these are non-specific. If you have a majority of these symptoms, most likely you have it. You need further testing, and I'm going to show you how to do it. I'm going to make it real simple for you. Okay, so number one is fatigue. These people have fatigue, and many people with chronic fatigue have this issue. They're highly sensitive to mold, and they have the genetic glitch where they can't get rid of mold toxins. Number two is weakness. Then there's decreased assimilation of new knowledge. And this is where I was working on my book, The Brain Zone. These people can't focus well, and they can't learn new things. They also have memory impairment, and they can't find the word. They just are seeking for the word, and they forget the words. They have to think of new words because they can't find the old words they used to know. Also, they have aches and pains, muscle aches, joint aches, headaches. But the headache's different from regular headaches. This is like an ice pick being driven through your brain, okay? They are very light sensitive. Very light sensitive. You shine a light, and I had 2 patients yesterday. I saw 2 autistic patients yesterday, Mary, and each one I couldn't shine the light in their eyes. And these patients had a lot of the symptoms of this. So light sensitivity is major. If you have light sensitivity, that's a major sign. Okay, then difficulty concentrating. A lot of people call this ADD. They say, all of a sudden I developed ADD or ADHD. I can't focus. I can't concentrate. Joint pains is a major issue. A lot of patients with fibromyalgia have this condition, and they've never been checked for it. Also, morning stiffness. They're stiff in the morning because a lot of inflammatory cytokines or inflammatory chemicals are increased in the body. Now, I check HSCRP on all my patients as an inflammatory mediator cytokine, but it doesn't raise that cytokine. It raises other cytokines. So most doctors miss it because it's only a few tests that can pick this thing up. Okay, also many people get cramps in their legs, cramps in their hands, cramps in their muscles, cramps throughout their body. Also, they have unusual skin sensitivity and many times tingling in their skin. Many get short of breath, and many have sinus congestion. Also, a lot of people with asthma. Asthma is another sign of this problem of mold. It affects the lungs in a lot of people. Many develop a cough. Excessive thirst is major for so many people. They're thirsty all the time. Now, it's not diabetes. It's excessive thirst and excessive urination. Also, confusion. Appetite swings, where their appetite goes crazy sometimes, and they just want to eat. Also, difficulty regulating their body temperature, usually cold hands and cold feet. And people say, oh, it's your thyroid. No, many of these people that have difficulty regulating body temperature with cold hands and cold feet, it's many times they can't get rid of these mold toxins they're trapped in. I'm going to explain that a little later on. Red eyes, this is something we see. We usually see red eyes and red cheeks. They have redness in the white of the eyes. And again, it's so funny. I had a lady yesterday that was pregnant, and I noticed she had red cheeks and red eyes. And I said, oh, you've had red cheeks how long? Oh, I've had rosacea most of my life. And I said, how about your red eyes? Well, I've had that too. And I said, well, I went through every one of these symptoms. And, of all these 37 symptoms, she had every one of them. I said, have you been checked for mold? Well, no. I said, well, you're pregnant. I can't treat you now, but after the pregnancy, you need to have these tests done, or at least have the visual contrast screen to see if you have mold, or let's check your genetic factors to see if you have the genes for mold. But again, that's just something that I see a lot. And looking back, I've seen so many patients that I've missed because they've had these weird symptoms, clusters of these weird symptoms, and doctors have labeled them as fibromyalgia, chronic fatigue, chronic sinus infections, multiple chemical sensitivity, IBS-D, irritable bowel syndrome with diarrhea, chronic weight loss, chronic diarrhea, chronic food sensitivities, strange neurological symptoms, weird headaches, and it's mold. They can't get rid of the mold. And look at Leviticus 14. They literally say, if you have this mold and it's still spreading in your house, you got to tear the house down. You can't. We don't do that nowadays. We use the priests back in the days of the Old Testament. They were our doctors. They were our mold remediators back then. The priests were. Okay, so other signs are blurred vision. What's interesting about this mold issue is that one of the first organs that affects is your eyes, and it decreases blood flow through the retinal artery to the eyes so that they get many times blurred vision, and they have a positive. This visual contrast sensitivity testing that we do is abnormal because that artery, the retinal artery, is being constricted and spasming many times so that they can't see clearly. They can't focus good, and they get blurred vision. They also many times have night sweats, and a lot of women are having night sweats, and they're in their 70s or late 60s, or they're past menopause, and they're having night sweats. It's many times due to the mold toxins, as well as mood swings. It makes people have a moldy personality, and they get irritable, grumpy. And so when your wife's irritable, grumpy, you're saying, oh my gosh, what's happened? I put her on all of these calming hemp oil or CBD oil or progesterone that's supposed to make them sweet. Why are they so grumpy? They have a moldy personality. They have mold, and there's mold in the house. And you walk in your house and you smell that mildewy, moldy odor. That's mold. There's mold floating in the air. It's making your brain sick. It's making your personality sick. But then they get those, again, ice pick pains, especially in the head, the headache, like someone's driving an ice pick through your brain, abdominal pain, cramping, diarrhea, numbness. And I look back at my patients, and in fact, I told my nurse today, I saw a patient about a year ago who was in her mid-70s. She had severe food sensitivities to every food. She had severe diarrhea, had lost like 20 pounds, couldn't eat, couldn't gain weight for anything. And back then I didn't think of mold. Now, looking back, I told my nurse, I said, let's find this lady because now I know what I have to test for. Because those people that have unexplained weight loss, loose stools, they're dropping weight like crazy. Many times their body has these mold toxins from a water-damaged building, and they can't get rid of them. It's affecting their gut, and literally they can't turn it off. We have the key answers, though, you're going to hear today. Other symptoms are a metallic taste in your mouth. You're tasting metal. That's many times mold. Also, tearing in the eyes, disorientation, they get disoriented, numbness, tingling, tremors, as well as static shocks. For some reason, these people, well, the reason is because they have increased osmolality, and we check the blood for osmolality. And what happens is these people are thirsty, and they're drinking water all the time to correct it. So they're urinating a lot, and they have static shocks, common thing we see, as well as dizziness or vertigo. Now, these are the main symptoms that we see. And first, we do this visual contrast sensitivity test that I talked about. So anyone can do this test. They can go online and have this test done. And like I say, that's the simplest screening test, and ophthalmologists have been using this for many years. And what happens is there's 5 columns that you look at, and the columns A and B, everyone can see, but then columns C, D, and E, if you have difficulty seeing that indicates poor retinal function, and it's related to biotoxicity, usually from mold. Now, you can simply go to vcstest.com, and this is a free test you can do to see on your computer.
Okay, that's V as in Victor, S as in Sam.
No, VC as in Colbert.
Okay, all right.
Okay.
Well, okay, say it again.
VCS
As in
test,
Sam.
TEST.com. It's a simple little test you do on your computer, and you can donate $5 or $10 if you want, which is great if you will, to help them. And this is a simple test that's real inexpensive. And if you fail that test, there's a strong risk that 98+% risk you have some mold toxins. You have mold toxins.
We're all exposed to mold. So,
Yes.
I mean, you're not going to get away from mold.
Right.
So forget that. But normal, healthy people with the genetic makeup, that the majority of the population, they have the ability to detox the mold toxins they get exposed to. But there is, according to their studies, 1/4 of the population. Is that
Yes,
correct?
1/4, about 80 million people
That's
cannot get.
incredible, Don. That's a huge amount of people who don't have the ability to detox the mold toxins that they get exposed to. They don't have that genetic ability to detox.
Now,
Correct?
right. Now, let me just paint the picture because it's not so simple, folks. According to the World Health Organization in 2009, guidelines for indoor air quality, it states that based on studies in the U.S., the prevalence of dampness or mold in homes to be approximately 50%. 50%.
Well, I mean, we live in Florida, and Florida is one big, huge bubble of humidity. So, literally, all the buildings, the people's homes, I mean, we're exposed to humidity
But
on
wait
a
a sec.
level.
But wait a sec.
Okay.
Humidity doesn't hurt you, Mary. It's mold and water damaged buildings. The mold feeds on the particle board, the drywall, the wood, the carpet, and it creates these toxins. And these toxins become airborne, and then it gets into your body. And these people with this genetic glitch, they cannot get rid of the mold toxin, so it unleashes inflammatory mediators throughout the body that creates chronic inflammation. It causes neurological issues. It causes dysregulation of hormones in the hypothalamus, pituitary throughout your body, and it's causing a sea of symptoms and medical illnesses that unfortunately most all doctors are missing. And so we have to, first of all, identify where the leaks are. The mold that's living in your wall, in your ceiling, in your HVAC, which is your heating, your ventilation, and AC, or in your basement, or in your carpet, you see the stains on the wall, just like the Leviticus chapter 14 talked about the stains. The mold will live in that drywall, live in that wood, live in that ceiling, but it doesn't just live there. It grows there. It expands. It creates these deadly mycotoxins that for 25% of the population, they genetically do not have the immune system to rid itself of these toxins. They can't get rid of them. So we have to get rid of the mold first, and that's why there's a full way to do this. We explain it through. You got to go through the house. You got to use your nose. You smell.
Now that's why in real estate, when you sell a home, you have to disclose if there's ever been water damage. This is the reason. Wouldn't you agree? So that people who are buying the home know that it's been taken care of. I'd like to tell a story if I could, real quick.
Go ahead. Yeah.
My sister Debbie was building a brand new home over in St. Augustine area, or not St. Augustine, St. Padre Island. Anyway,
But that's in Texas, Mary.
No, not Texas. She was up in, where am I?
Jacksonville, Mary. Say
I know,
Jacksonville.
but it was up there north of
North
Jacksonville.
Florida.
Okay, North Florida. Anyway, she was building a new home, and you know how the process of building a new home, they go through all kinds of, phases. And she brought her friends over to look at it, and they had just put the drywall up and stuff. And she walked in, and in the drywall, on the baseboard, all along inside the house was the black mold. And the builder had placed humidifiers in there, and they intended to try to dry this house out and then paint over the mold. And so, of course, she just was devastated, and it just by chance found it because she just happened to stop in while they were building her home. So some good advice to people out there building a home: visit your house regularly, look at it and watch it as it's being built. Don't just, but anyway, so she had to call the builder and say, listen, we're not buying this house, because there is no way you can get all the black mold out of this house that's being built. The whole foundation, it was built on a marsh. So it would have killed my sister.
Well, it probably would,
that.
the black mold, because that's that Stachybotrys. That's a real toxic mold. But going back, follow your nose. Go through your house, and are you smelling musty, mildewy odors? You can bet there's mold there. You need to investigate. Are you seeing mold around the windows? Are you seeing mold
from the roof,
from
most
the
of the
roof,
time.
from the drywall?
Yeah, the
You look in
ceiling.
your bathroom, do you see mold where there's been water stains or mold stains growing under your sink or in your kitchen or where there's water? Usually the most water is in the bathroom, and that's where there's mold usually. Has there been leaks, and have they not adequately cleaned up? Has it gotten in the drywall? You just covered it with what, kilts, what's it called? And now all of a sudden you see that discoloration. That's mold growing in there. You got to get rid of that because it's outgassing mold toxins, and it can make you sick if you're part of that 25% of Americans who can't get rid of the toxins. So follow your nose. And then some people need a mold inspector that can go out there that's reputable. And now this is kind of sometimes hard to find.
Now, it's MOLD, not
mold.
MOLE.
Yeah, now we have a mold in our yard in Texas, and I've had
Wanna
to get
make sure
someone to
people-
kill the mold that's in the yard that's tunneling through my yard. It's not those kind of molds, MOLE, it's mold, MOLD.
D inspectors. Okay, I just want to clarify that.
But some simple test you can do is just mainly go through. It's pretty obvious. You can go through and you can go and get what we call you can do an ERMI or a Hertzme test. ERMI is ERMI test, or Hertzme, HERTSMI. And these are tests that check for mold that's in, along the baseboards. You use one of these little Swiffer type instruments that'll trap the dust from the mold, and then you send it off, and you do certain areas, and you send it into the lab, and they test for it. Or you can get someone to test. It's just cheaper to do it yourself. And the ERMI actually stands for Environmental Relative Mold Index. And you can get that if you want to get your own test. It's from mycometrics.com. That's mycometrics.com. And an ERMI score should be less than 2. That's a healthy house. Or Hertzme score less than 10. And that's an indirect way to do it. But then sometimes they'll miss HVACs where, many times the mold is in the HVAC system and the heating, the ventilation, and AC. So many people have to get those cleaned out.
But you want to make sure if you're going to have somebody come out, you better check and recheck and get references.
Yes.
Let me stress this.
Good, Mary. Go.
Get references of people who have used them before. Don't just take a salesman's job, because this is a big con job out there. There are some unreputable people out there doing it, taking advantage of people. So you want to know that who you're getting is a reputable company that has a good reputation, and they know what they're doing to look for. Now, there's different levels of expense for you to go through. If you suspect, you're sitting here listening to Dr. Colbert and you think, I am in a sick house, or I'm working in a sick building, and he is describing me to a T, and you could be one of those people. Probably the first place you would want to start is with yourself. First, find out if you have that inability to detox mold toxins. So I would suggest...
Well, let's tell them how to do that too, Mary.
It's a blood test.
Well, it's a blood, or you can do a buccal swab, and you can get this done. Your doctor can order it, actually.
Okay.
And it comes from usually LabCorp or Quest. But you have them check the HLA gene test, or it's human leukocyte antigen, HLA gene testing, which we check. There's certain genes. If you have these genes, you're going to be highly susceptible to mold. We call it multi-susceptible to mold, or mold susceptible, and then there's multi-susceptible. So the gene test will go like this, and we have the code. If you need it from the office, we can get it for you. But to be mold susceptible, these people usually...
When you say code, you mean for insurance reimbursement?
No, not for insurance. These are the HLA, the gene test.
Okay.
You have these genes.
Does insurance cover this?
Some do, yeah, they do.
So
some will, not all of them will. But the
Okay.
test is not that expensive. We priced it out. The test for HLA typing is $206. And again, there's the buccal swab too, so you can see if you have these genes. These genes make you mold susceptible. The DRB1, gene 7, 13, 17, and 18. And you say, well, gosh, I'll forget all these. You can go down and write these out.
Listen to the podcast again.
Yeah,
over
listen
and
again
over.
and write them down. So the mold susceptible patients have the DRB1, the 7, 13, 17, and 18, or the DQ gene 2/3, comma, 6, comma, 2, comma, or 4, or the DRB3 gene, which is 52A, comma, B, comma, C, comma, 52. Yeah, that's it. That's the DRB. And then the last one is the DRB4 53 gene. So those are the ones, if you have those genes, you are mold susceptible, which means you can't get rid of the toxins. Now, most of the doctors won't know how to read this. You may have to find a doctor that has done what we call the Shoemaker protocol. Dr. Richie Shoemaker is a brilliant physician who figured this out back in the 90s, which is absolutely amazing what he's done. First of all, let me just explain. Dr. Richie Shoemaker was a family doctor in Maryland, and there was an outbreak of these strange symptoms in the Chesapeake Bay area that saw the death of thousands of fish. And they found out that these fish contained toxins from this dinoflagellate, which is from blue-green algae, and is literally a toxin. And he later found similar toxins in algae-bearing lakes in Florida, and in cases of this foodborne illness from eating certain contaminated seafood, and it was called ciguatera. And he realized that along with mold exposure, all of these illnesses shared a pattern that was consistent and treatable, and he treated it with a binding agent called cholestyramine, which we've used for years in treating cholesterol, but it bound these toxins. They couldn't be reabsorbed back through the bile and excreted them in the toilet, and so these patients were able to be cleared up. So he literally found a major key to mold illness, and we want to talk about that on the next broadcast or the next podcast.
Exactly. So we're going to give you some answers to empower you. Should you come back and you say, yes, it's been tested and I am one of these people, what can I look for? What can I do to help support your body? Because let me just tell you something. I don't care what it is. God has an answer for every disease, every battle you may be going through. I promise you, God has an answer. But many times what it is your job to pursue and find the answer. It's here. God has given us the answer. He's put everything here we need for every issue in every way. But a lot of times what's happened is we've become lazy and we just wait for someone to tell us, and that is not part of the plan. He said, the kingdom of God is like a hidden pearl. Sell all that you have to find that pearl. And many times the pearl that you're going to need to find and pursue and look for is answers to your health. Sometimes it's not just going to be given to you. God requires you to press in and find the answers sometimes. But anyway, that's what Don does. He's a pursuer of trying to find what it is. But it's still going to be your job to do your part. It's a partnership. We appreciate you listening to Divine Health Podcast. Go to drcolbert.com, our website. We have anytime you buy any of our products and with Divine Health, you're supporting what Don and I do. And we bring this to you free, no charge, but that's our support for Divine Health Ministry. We appreciate your support. Keep us in your prayers, and God bless.
God bless.